Hi, let us demystify some commonly used terms in medical writing and health communications. Knowing this comes quite helpful. Let's start with CME, Continuing Medical Education. CME refers to educational material that helps a medical professional, to build and develop his professional knowledge and clinical expertise. Then there is KOL, Key Opinion Leader. KOLs are the experts from a particular medical field. Their insights guide education and research. You might also come across terms such as MA or MSL. MA, which stands for Medical Affairs, is an entire department within pharmaceutical and biotech companies which will focus on communicating scientific knowledge and information to the HCPs. HCP, another commonly used acronym, stands for Healthcare Professionals. Now coming to the MSL, which stands for Medical Science Liaison, is a field-based professional from the Department of Medical Affairs who builds relationship with a particular KOL and exchanges scientific information. Take it as your bank relationship manager talking to you and building relationship with you over the calls or meetings. Next, a foundational concept, EBM, evidence-based medicine. EBM means making clinical decisions using the best available scientific evidence in the form of latest updated data or literature. So when a clinician takes a decision regarding treatment, he uses his clinical expertise, clinical experience along with this evidence-based scientific data. You will often hear terms such as medical communication and health communication being used interchangeably, but they are quite different. Medical communication is usually for HCPs. So the information here would be technical and highly detailed. Think of research papers or specialist modules. Now, health communication aims to make complex topics simpler and easy to understand for the patients and the public. Patient leaflets and health campaigns will fall under this category. Now for some new ones. SLR and TLR, terms frequently used in research paper writing. SLR, or a systematic literature review, is a very rigorous and comprehensive search of all the available literature around a specific research question. A TLR, on the other hand, is a targeted literature review. It is more focused, honing in on the most relevant studies for a specific purpose. So whereas SLR was focusing on all the available studies, TLR is focused more on the most specific studies. Let's talk about PROs, patient-related outcomes. A PRO is a health outcome directly reported by the patient without the clinician's intervention. So in a way, they tell us about the patient's perspective on a particular treatment or a condition. Think about quality of life questionnaires or pain scales filled by the patient, or even the symptoms diaries that they are filling in. So that's all for today. And if you have come across such abbreviations, please do share in the comments. Thank you.